Hey, my name is Dr. Hervey. I'm OBGYN in Phoenix, Arizona. Um, New to this whole blogging, web-based kind of communication, but I'm excited about the opportunity to come before you and to introduce myself to you and introduce a couple of thoughts and concepts that have come up in my practice. I'm an OBGYN, board certified, trained at formerly Pirog, here in Phoenix, Arizona, and I've been in private practice for 9, going on 10 years now. Love my patients, love what I do. Very enthused with the ability to take care of such a great population of patients. My practice is largely midwifery based. I have 4 beautiful, wonderful midwives in my practice. Another OBGYN in the clinic, and then myself, both clinic and hospital based. Well, with that stated, my purpose today is really to introduce you to our practice the same way I would introduce myself to a new patient. Again, I would introduce myself. My name is Dr. Michael Hervey. Welcome to our practice. I'd like to take a moment and tell you what makes our practice stand out a little bit. What we care about most here is 2 things. Number 1 is that you get good care. That's paramount, that you get really good care. The second thing I care about is good experience, right? What that means to you and to me is that we are not the providers in this practice that walk into any clinical environment and tell a patient what to do and or how to do it. We are the providers who walk into that clinical environment and provide you with your options to your care, as long as you're safe. You get to decide what happens to you, your body, your baby, your family, as long as you're safe. I tell every patient I meet, anyone who does something to you that you did not want them to do is called assault. Our job is never ever to assault you. Rather, our job is to educate you about your options, your care. You're the boss. I want to make it very clear to you what this means. That means in a laboring situation, I would never walk into that room and say, I'm going to check your cervix. I would walk into that environment and offer you a cervical exam. On the monitor, your baby's safe, you're looking good, the baby's looking good. I would offer, would you like to have an exam? Yes, no, etc. Similarly, I would not walk into that room and say, I'm going to break your bag of water. I'm going to start Pitocin. I'm going to do something to you. I would walk into that room and suggest, hey, it's been some time now. You haven't changed your cervix. And your options are, 1, we can continue to do position changes and other things like that. Sit on our hands, wait, watch, and see if your body will pick up into more active labor and change the cervix. Or we could break your bag of water to speed up the labor, or start Pitocin, or a list of other options and alternatives to help you augment your labor, to expedite labor, period. And then again, you would decide which of those options makes the most sense for you, your body, your baby, your family. Now, I do ask this of every patient, is that if there's any level of urgency or concern, I can walk into that environment and have the permission to express, this is urgent, and I'm worried about your safety and or your baby's safety, your family's safety. And in these circumstances, we typically do X, Y, and or Z to keep you safe, and I want to be able to move very quickly and keep you safe. Again, welcome to our practice, and this is Dr. Hervey.